I'd like to invite to the stage Jacob West, who is Director of Healthcare Innovation at the British Heart Foundation, and he's going to talk to us about community mobilisation and the opportunities for CVD prevention.
Thank you. What links vegan sausage rolls, zombies, and flat-pack furniture? I'm going to try and convince you today that these are all examples of new power. You've heard a lot about old power today. I'm going to talk to you about new power, which is people power. And this is democratic, decentralized, digital movements. So let's start by rolling back to late 2010 in Tunisia, the Arab Spring that took off across North Africa in the middle of it and the Middle East. At its heart was a sense of agency, that people could take control of their own lives. I think we need to think about how we can harness that for addressing prevention in cardiovascular disease, the fruit of a sense of responsibility. And we need to do it, as we've heard today very eloquently from the other speakers, because it's killing 1 in 4 of us. Millions of people are walking around with these silent killers. And how do we wake them up? And we need to do that because these risk factors are largely preventable. About 7 million people in the UK don't know they have high blood pressure. About 50% of people with elevated cholesterol don't know they have it. How do we get them to know and act on these numbers? The long-term plan, as we heard about this morning, is a terrific start. 150,000 heart attacks or strokes, that's the ambition. But these are old power structures and old power networks. If we really want to get a transformative effect, we're going to have to think beyond policy documents. We're going to need to mobilise through new power. And at the British Heart Foundation, we want to work with everyone in this room and beyond to start that happening. Think about the IKEA effect. You value something more if you've had a hand in building it. You have this sense of agency. So we need to think about how we could apply that to a cardiovascular environment. How do we make it simple for people, easy and fun to act on? I'm going to talk you through a few ideas. So firstly, get that core idea right. I think Me Too is a fantastic example of that. Tarana Burke started this grassroots campaign in the early 2000s. It took off in October 2017. Hashtag Me Too was then shared 20 million times over the course of a year. It's spread across multiple countries, industries and sectors, and it's got that compelling idea at the heart. Here come the vegan sausage rolls, which I'm not endorsing, but this is about making it easy to participate, connecting people with in the reality of their lives. So veganism used to be, it's hard, it's about self-sacrifice. I think the Greggs sausage roll was a sort of tipping point because in a metaphor it says it's easy, it's convenient, it's something that could actually enhance your life. Thirdly, it's about the power of peer networks. Who knows about Strava? It's about giving kudos to your friends who are cycling and running. It has over 1 billion people giving kudos. 1 billion hashtag give kudos happened across the world for their running and cycling efforts. The number of commutes has exploded. 1 million people are joining every month. It has a massive environmental as well as a health impact. So these networks can absolutely transform activities. Take Parkrun with a similar model. 13 people started in Bushy Park in 2004, organised by Paul Sinton Hewitt, unemployed, keen runner with an injury. It's now had its 5 millionth participant. Rich or poor, this is democratic. In the poorest parts of Glasgow, there's a park run, right through to Kensington and Chelsea. 400,000 people volunteer. It's changed weekends forever. And interestingly enough, just to show this democratic point, the average running time in 2005 was about 22 minutes. This year, it is over 29 minutes. That's actually a fantastic result, as they see it. It's democratic. It's not just the Olympian. And technology, fourthly, runs through all of this, to communicate, to share, to rally. In the Arab Spring, this was fundamental because media was highly regulated. You needed social media platforms to cut across. So how can we start applying some of these principles to cardiovascular disease? Let's start with Million Hearts, the campaign in the United States. So this is not a pure grassroots campaign, but it did bring together 12,000 health and community organizations around a single compelling idea. How do we save 1 million cardiovascular events by knowing your ABCs? It's got there in phase 1 to 500,000 cardiovascular events reduced. Closer to home, we talked about Jamie Oliver. Here's Hugh Fernley Whittingstall. Newcastle Can, their compelling idea was losing collectively 100,000 pounds of weight really nice, simple idea, and it's spread, by the way, from Cornwall to Norfolk. There's this collective ambition to lose weight as a city. And we need to make it easy for people. Thirdly, in the BHF, we are sponsoring blood pressure testing programs in football stadia, in barbershops, in train stations. There's new technology that can underpin this. We have ourselves 750 retail stores. We want to get testing in every one of those stores so that we take it out to people, don't allow people to have to come to us. Peer networks, thirdly, are fundamental to this. In Canada, they trained hundreds of volunteer peer educators to start to have conversations with people, to test them for blood pressure, to educate them. This is a different kind of conversation than if you're a healthcare professional. And it's had a big impact. It's reduced by 10% their cardiovascular events. The technology, of course, makes it fun. It makes it a mix of community, it creates data, and there are new blood pressure devices, several of them out there, new cholesterol devices, new digital platforms that allow you to make that a much different experience than what it used to be. Building on that, last week we had a hackathon with Amazon Web Services, and this is about gamification. This is where the zombies come in. Zombie Run is an immersive game where you exercise while you play it. 30 million kilometers have been run by their collective participants, and 4 million downloads of this. So I hope I've convinced you that this is about people power. This is about democratizing, digitizing, and decentralizing our traditional power structures and giving people the opportunity to take agency and care of themselves. Thank you.